Good. Well, we were just while you were waiting to get here, the conversation here was a little bit about the floods, and we're mindful of all the people across the province of British Columbia who are struggling with the challenges created by the weather event that we've experienced here and the significant devastation that's happened across the province. But let's just go ahead and get started, at least by inviting Vicki, who is the presiding officer of Chinook Winds region, to bring us together in a moment of prayer to start our time together.
Good afternoon, everyone. It's nice to see everyone's faces, and let us take this opportunity to pray. Loving and mysterious God, hold close to you today those that are dealing with the Mother Nature working so ferociously in British Columbia, and hold those that are dealing with hospitalization and illness due to COVID and other illnesses that cannot be treated at this time due to hospitals being so full with people infected by COVID. We give you great thanks on this day for the opportunity to gather from far and wide, to be with one another on this Wednesday afternoon, to spend time and to hear from Alan from the General Council. May this time together be rich with learning and discussion. Be with us as we discern together with the wider church as to our change in benefits and how that will impact employees and clergy across the church. Give us the ears to hear and the patience to learn and to ask, so that we may better understand how the church is moving. In Jesus' name we pray. Amen.
Amen. Thank you, Vicki. So the theme of our time together today is to focus a little bit on the changes that have been announced by National to the employee benefits. So this affects all ministry personnel as well as lay employees of the church. So some of you may be here as treasurers or M&P committee folks to learn, as well as people who are personally impacted by these changes. So we just felt it would be good to have an opportunity to hear about the changes from Alan, and to talk about or respond to any questions that you might have. So how we're going to do this is Alan's going to first just give us a bit of a presentation and let us know all of the things that are happening, and then we'll have an opportunity for question and answer time. I'm aware that this is an emotional topic for some people, so I'm going to just remind us that, you know, nobody is personally responsible for this, and so we just want to be respectful in the way that we approach ourselves and the questions. I'll ask you to raise your hand electronically or type your question in the chat when we get to that point. And so without further ado, Alan, we'll turn things over to you.
Thank you. Good to be with you folks. And certainly for the West Coast, we are following closely the news of the weather events and environmental impact that you're bearing so directly this year. It is truly frightful, and so the proceedings the last few weeks in Scotland with the environmental conference has had all of us attentive, and I think bringing new appreciations to the roles that we play and what we need to be doing. So thank you. I have prepared a slide deck, and I don't know if I have screen sharing abilities yet or not. But what I would like to do first is just walk through the why, the how, and the what. And probably, I'm thinking it might be best if I walk through the deck and then we do questions unless there's something really pertinent to a specific on a slide that you would like clarification for. And I trust Treena, you or someone will
yeah, I'll moderate the questions when we get to that point. So I think it's good for you to go ahead. I did just want to note that I neglected to acknowledge the land on which we are gathered as the traditional and in some cases unceded territories of the Indigenous people across both regions. So if people feel called to, you can put your own acknowledgement in the chat as we proceed. So thank you for that. And yeah, go ahead and share your screen, Alan. I think you're co-host now.
Yeah, Mauricio, I'm logged on with 2 screens. So if you could give me permissions on the other one, that's
Okay.
just a picture.
You're okay to go, Alan.
Okay. I intensely dislike my Surface Pro, so I'm using my iPad because it's more interactive for me, but I'm using the Surface Pro to share. So that's why I'm on twice. And I have no idea why I have this voice that you're hearing. I woke up this morning with it, and it sounds like I've been smoking and singing blues all of last night, which trust me, I was not doing.
Maybe you were afraid.
Maybe that's right. Anyway, it's quite raspy, don't you think? So thank you for having me today. I'm glad to have this opportunity to share with you some information that I expect most of it you will be familiar with as you've done some of your own research and as you've read some of the material that has been available. I want to start with the basket of benefits that we do have, and it's employment in the United Church has its challenges, and particularly during COVID, it has been stressful. But we also, as an employer, have a generous basket of benefits that are provided to all of us. So let's start with the core suite of group health and dental benefits that our employer paid. And there's some often that hasn't been visible to folks who are purchasing the optional plan. The core plan is across all employees and ministry personnel, and it is the employer that pays for that. And I'll speak about the optional benefit later. So the core group of health and dental benefits, there's 6 months salary continuance in the event of a medical leave of absence. Accidental death and dismemberment insurance. I'm not sure how much dismemberment happens, but I know board meetings can get rough. Life insurance for employees equal to 1 year's salary, and life insurance on dependents. There's also an employer indemnity plan for ministry personnel in the pastoral relations system, which is the equivalent to 6 months salary. And long-term disability insurance, which of course the employee pays for, that then leads to a tax-free benefit should you be in need of drawing that insurance. But a unique part of our long-term disability plan is that the employer continues to pay through the reserves of the plan, both the benefit premiums and pension contributions for the duration of the long-term disability. I mentioned the optional plan, and that's the focus of most of our attention today. The optional plan is a supplemental health and dental plan on top of the core benefits. So it's a top-up that roughly about 40% of the members, employees, and ministry personnel have opted to purchase. There is also an optional retiree group health and dental plan, which is quite separate from the active member plan, but an optional group retiree plan that is paid for by retired ministers, and they elect whether or not to join that plan at retirement. And roughly about 50% of retired employees and ministry personnel do participate in that plan. I mentioned that we have a generous set of benefits. We've been looking at compensation lately, and we've been reminded by the consultants that about 30% of our compensation is in benefits, generous set of benefits, from additional holidays, amortized sabbatical, study leave, vacation, health benefits, and pension contributions by the employer. So that's an interesting piece that we often don't think about and we don't see, but is an important part of compensation. So benefits overview. Let's look at some of the key insurance products that that we have. We see that some of the benefits run with small surplus, basic life, dependent life, long-term disability, health. And I might note with long-term disability, one good piece of news, we had a year of exceptionally high incidence of disability. And because we smooth our averaging of experience over multiple years, that year of experience has stayed with us and has kept our premiums high. That year moves out of the smoothing in 2022. And so that means that we see a significant decrease in long-term disability premiums. So just watch for that. Benefits with a manageable deficit that can be accommodated with some tweaks to premiums. Moving forward, basic life for pensioners, accidental death and dismemberment, restorative care plan, which is the short-term disability salary continuance that I mentioned, and the dental plan in the core product. Where we are seeing problems, and these have been emerging over the last couple years, and we've been focused on trying to better understand them. First, with the optional health plan, $2.1 million shortfall. When I say a shortfall, this is not a Green Shield product that we've bought. This is self-insured. Green Shield administers the plans for us, for a fee, of course. But the 2.1 million that I cite here for health optional, the plan reimbursed our members 2.1 million more than plan members contributed. Pensioner health was also in a deficit with 0.8, pensioner dental with 1.1 million, and the optional dental at 0.3 million. So that was the problem that we've been looking at and attempting to address. In 2020, the executive of the General Counsel decided to move the retiree plan to self-sustaining by 2025 through annual premium increases of 13.7%. I mentioned earlier, about 50% of retirees elect to join that plan. So it's not a retirement benefit per se, like the pension that you've contributed to and all employees receive. This is the election of half of the retirees. The decision was to fund this transition, even though it's not beneficial to all of the retirees. The decision was to fund this transition to self-sustaining through continued subsidies from the group plan's reserves over these 5 years. And that we would undertake a forensic review of the active member plans with recommendations in the fall of 2021, including the possibility of discontinuing the optional plan. That review was undertaken through the rest of 2020 and 2021, and staff worked with consultants and actuaries from Hub Benefits team and a task group that was comprised of a GCE member, a minister, and an insurance risk executive. And with the actuaries, we took a deep dive into all of the data related to the plans, the spends, the experience, the funding, the demographics, so that we could understand where the costs were being incurred and what might be driving those costs. The conclusion that we brought back to the executive was that the core plan is sustainable with 19.5% employer premium increases in 22 and 23, and that they will begin to drop. The optional plan premiums would need an increase of in excess of 150% to be sustainable. In response to last year's 50% increase in premiums for the optional plan was that further increases of that magnitude were not sustainable. And even if reserves were unlimited and long-term subsidization of the optional plan for the 50%, 40% of employees who elected it would not be sustainable or fair. So the decision of the executive in September was to close the optional supplemental plan effective January 1st, 2022. Focus on securing the durability and sustainability and affordability of the core plan for all employees and eligible administrative personnel, recognizing it as an essential employment benefit that is paid for by the employers and the communities of faith. I use employers and communities of faith because we do have non-congregational participating employers. So both are part of our plans. So what does that look like? If you're familiar with the core plan and if you've looked at it, there are not significant changes to what is offered. There are a couple, but not many. For those of us who have been on the optional plan, and I'm a long-term member of it, there are changes. The first is around the deductible for drugs and medical. Moves from $50 per single family to $250, which is no change from the core plan. The drug reimbursement will be moving to 80%, with generic the default for our drugs, which is our current practice. We're moving to a managed formulary, and that sounds scary, like there are a whole bunch of drugs that will be excluded. Instead, what it is, the formulary that is common in drug plans is one that excludes new drugs until it's proven to be as effective or more effective than already available and listed drugs. So that's the main difference. New drugs are often more expensive and they're touted to be better, but clinically they may not be better. So we take advantage of the research that is done and seek to control costs by not introducing new drugs that do not introduce a significantly new or advanced clinical benefit. Pocket Pills is an online pharmacy that was introduced last year, and it's an optional election for members, but members who have chosen it have spoken highly of the efficiency and effectiveness of it, and it is because of a much lower dispensing fees and the bulk buying, it does result in cost savings for the plan. The out-of-pocket maximum will apply only to drugs. So after you've spent $1,000 on drugs, then the plan covers the subsequent expenditures. Orthopedic shoes, again, a drop from the optional. Eye examinations, for those in the optional plan, it's a reduction from 200 to 100, but it's an addition to the core plan so that all members will have access to $100 benefit. I don't know who has glasses for $100 unless they're the reading glasses that you see on the counter at the drugstore. Mine cost far more than that, but the vision care benefit is one of our more expensive benefits. And out-of-country benefits increase significantly, as you see here. Another change is that the paramedical practitioner's maximum is at $500 rather than $750, and it is the accumulation within the top four there, rather than individually. We've carved out as individual maximums, the 3 that you see. And we've enhanced the medical providers that will be covered. We've had lots of ask for, and will now cover counselor, psychotherapist, and psychoanalyst. And then when you look down again, you see changes in deductibles from the optional plan. We recognize that any decision made has implications, greater implications for some than for others, but have implications. There's no decision we could have made that would have no implications, or that would have brought an increased benefit for everyone. So this is a very difficult decision that the executive wrestled with. And I know it hasn't been popular, but perhaps we'll talk a bit about that shortly. First, some of the most frequently asked questions that we have received. One is, how much will I have to pay per month for the new active plan? So we talked about the core plan, which exists now. There will be a single plan that we're referring to as the active plan, the active member plan. There is no cost to the plan members. It is entirely employer paid. Do I have to participate in the active plan? Yes. It is co-administered with the pension benefit, and participation is required for all employees and ministry personnel, eligible ministry personnel who are working 14 hours or more. With our system improvements, we're now able to move into compliance with Pension Benefit Act regulations that multiple part-time positions that together add up to 14 hours or more will participate. Previously, if you were working 14 hours or less in multiple positions, you didn't qualify to participate. You will qualify moving forward. This is the most common question. I'm currently taking X drug, will it be covered under the new active plan? If you have a drug that you are receiving reimbursement for now, that will be grandparented, carried forward, whether or not it's on the formulary. No, you will not find January 1st that a current medication that you're on is not covered. And what effect does this have on the retiree health and dental benefits? It has no direct effect on the retiree health and dental benefits. As I said, that's a separate plan. There's an indirect effect in that by eliminating the optional plan draw on the reserves, we're able to give that 5-year transition period for the retiree plan. It preserves the reserves for that. At the end of that 5 years, we will still have a reserve fund for the plans, which is only prudent in case there is some significant adverse experience that would be cause hardship to accommodate in a single year's premium increase. So we'll maintain a reserve, but a much smaller reserve, and one based on actuarial assessments of what is required. So Treena, back to you.
Thank you. Thank you for the very comprehensive outline. So probably just to address the elephant in the room, maybe we should do that up front. There's been a bit of criticism around how these decisions and changes were communicated. I wonder if you just wanted to say a word about that.
Sure. There was not ongoing communication over the year during the review because we were dealing with data, and in retrospect, to have had announcements or mentions in communication vehicles that the study was ongoing would have been helpful and would have alleviated some of the surprise when the announcement was made. In regards to the actual timing of the announcement, we had a communications plan that was set and ready to go at noon on Wednesday, and I think it was Wednesday morning that it was posted on the Commons and became public. So we didn't have an opportunity to bring you fuller information before it had already become, in some social media circles, crisis of communication. So
Thanks.
yeah, and I'll say, as I said to the General Secretary, that rests on me, and it is not the executive or the General Secretary that stops with me and my staff. So,
well, hindsight's 2020, but I expect that all of us have learned a little from that experience. So hopefully we won't make those same mistakes in the future. So there's, if you want to start putting your questions in the chat, that would be great. If you feel like you want to speak your question, just electronically raise your hand. I can't see folks, so I'll need you to use the electronic thing. But first question is, so someone on the optional plan has been getting their claims denied since November 2nd, and the message is that their benefits have been terminated.
okay, I need to do a call to the benefits center about that. Benefits, if it's saying that benefits have been terminated, what we did have was payroll at the end of September, where it hadn't been authorized to run early because of the new holiday, ran on October 1st. And that triggers a chain of processes where no payments had been received in September, and therefore benefits are discontinued until the reason for you being listed as inactive in the system is verified. So that was one experience that several people had. If it may also be that you have maxed out a particular benefit, although that doesn't jive with terminated. But I know I've heard some folks who have been saying that as they moved into the fall, they had been denied coverage on specific benefits, and it was for that reason.
So how should they remediate that? Do they need to contact the Pension Benefits Center?
Yes, contact the Pension Benefits Center with your ID number and your specific issue. They may be able to troubleshoot it at that time. They may have to go back to Green Shield and chase it down to see what actually did happen.
Good, thanks. And in a case like that, obviously keep your receipts, because once it gets sorted out, you'll still be able to be reimbursed.
Yes, benefits are always retroactive if they have been discontinued and then reinstated.
Great, thanks. So question about why there wasn't more consultation about the different options, and whether people would have been willing to pay more, or other kinds of responses. And secondary point around that is just the 2 months notice feels short for people who were relying on those benefits. So could you speak to those 2 points?
Sure. On the consultation, the decision was driven primarily by data. And I know folks said, if you'd asked, I would have said I'd pay more. We had heard so very loudly and clearly from plan members last year that the 50% increase in premiums was not sustainable on a go-forward basis. And we were looking at another 150% on top of that to move this into sustainability. And so it seemed to be a fairly clear message from many members a year ago. In regards to, sorry, the second question, Treena, I just lost it.
Was around the notice period being short.
Yeah, the notice period. Yeah, notice period was short because the length of the review took us into August. The GCE was meeting in September, and to have extended this into a longer notice period and into 2022 would have required us to shorten the transition period for the retiree plan, because the funds would not have been in the reserves.
Okay, thank you. Will this, the changes happen automatically through ADP, or do communities of faith have to make any changes in the hub or other, with ADP?
No, it will be processed automatically. Clergy couples should, however, contact the benefits center, because while both of you are covered under the core plan, there's better coordination of benefits if one of you is listed on the others as a beneficiary.
Right. Can you just clarify the percentage amount of increase to the community of faith?
I think I said it's 19.5% in 2022. It was 19.5 last year. And then I think it goes down to 17%. And then we anticipate that it will be the rate of inflation. And when we say rate of inflation, that may not be the CPI because drug inflation tends to run higher. And that is the largest spend in a group health plan.
Thank you. Could you just clarify it says change regarding the 14-hour threshold to mandate enrollment in benefits. But I don't think there was a change. It's still 14 hours, right?
Yes, it's still 14 hours. But if you're working part-time, multiple part-time positions that collectively are 14 hours or more, you'll be eligible for plan participation.
That's interesting. I thought that was already in effect. So we've been telling people that for probably 20 years. So yeah, that's all good.
Yeah. And we did not have the system capacity to implement that. So with the new systems that we are building, we have that capacity now.
So if you work for the United Church anywhere for a total of 14 hours or more, then you're required to participate in the benefits plan.
Yeah.
Good. I'm given to understand the maximum out-of-pocket for drug coverage we will have to pay for co-pays is $1,000. Can you confirm this is the case?
Yes, it is.
Okay. Thank you. So somebody was saying that many people didn't receive the email about benefits until this week. I get the need to fiscally make the changes. I would have been better about using my benefits this year if I'd known I was losing coverage. That's just a comment again about the notice. Mm-hmm. And orthodontic treatment. So this is one of the, I guess, the losses for families who are losing the optional coverage. And I know that's been an area of concern for folks. Orthodontic treatment started under the current optional plan. Can it be carried over until the benefit is maxed out?
I don't know. Email that question to me and I'll find out.
Okay. And the changes come into effect January 1st. Have we communicated with pastoral charges to let them know the active member contributions will increase basically 40% over the next 2 years?
That's part of the regular, I think it's in November that benefit costs are communicated to treasurers. This isn't new. This is an annual communication and adjustment to the feed. So I am not sure of the exact timing of that communication, but it's no different than it would be other years.
Yeah, and I think the communication overall about this benefits changes and the impact on both people who are beneficiaries of the coverage as well as communities of faith. It's all rolled out kind of at the same time. But that's one of the reasons why we wanted to do this town hall, so that folks did have the opportunity to get the information that they needed now. Have you given any consideration to an emergency fund for people that run into crises that they can't cover financially that might have previously been covered by benefits?
We have a financial assistance fund that is accessed through regional council staff, and it is available to members of the pension plan who encounter significant hardships. And so if you encounter such a hardship related to the insurance and health coverage, then certainly talk with your regional council minister, and they will assist you in making a request for assistance.
And just to confirm, the increased cost for communities of faith this year is 19.5%, and there is no cost to the employee for the active plan, and you will no longer be paying optional premiums if you were an optional member. So that's just in response to a significant request for clarification there.
Yeah, and for employers whose employees or ministry personnel were in the optional plan, those employers were still contributing to the core plan, because the core runs, as I said, supported that basket of benefits for all employees of the denomination.
So this is a question for clarification. I'm just going to read it to you. We pay the first $250 for paramedical practitioners, and then there is $500 a year. Does this mean $750 in total? Member pays $250, benefit is $500. Is this correct? I think the total reimbursement is $750, right?
The total reimbursement for paramedicals, acupuncture, chiropractor, massage, and naturopath and osteopath is $500.
500. Okay.
Yeah.
And the deductible, that the $250 deductible, that's just for drugs, or how does the deductible apply in the paramedical situation?
The deductible is just for drugs now.
Okay, so there's no deductible for the paramedical services?
I'm not seeing it here. Yeah, okay, so there's an annual deductible of $75 per family for preventative and $250 for basic and major.
Okay, so $75 deductible. Okay, perfect. Just a comment that loss of things like orthodontics disproportionately affect younger families. So I think that's definitely true.
Yeah.
Was there thought or conversation about that?
Yes, I mean, we looked at the cost of benefits and the breadth of the impact of a benefit. And unfortunately, we have fewer younger members. That's the challenge of all of our plans. And so the conclusion was other benefits would have to be cut that would impact more greatly a larger pool of people. So that was the reason for that. Yeah,
it's unfortunate. The other comment in that comment is the fact that things are being used is an indication of a big need, and a recognition that the loss of those services to folks is a big loss when it's responding to a big need.
Yeah. But the big need would have come with a much higher price tag for everyone to participate in it. So draw the benefit.
Yeah. So just to further clarify the previous question, so there is a total annual maximum that somebody would need to pay out for drugs of $1,000. So if you were paying your percentage and the deductible, the most you should have to pay in a year for drugs is $1,000, and then everything else is 100% covered.
That's right.
Yeah. Thanks. I hope that clarifies for you, Kelly. 14 hours, all are now required to participate, or do you have the option to opt in or out? And the answer is no. And if change of hours, is that still a life change that you can trigger an opt-in or opt-out of new or active benefits? So change of hours, unless it takes you below the 14-hour threshold, does not give you changes in the right. Plan, correct?
Correct.
Yeah. Okay. Okay. So the maximum orthodontic claim you can upfront is 35% of the total cost of the treatment. I tried to pay over half my bill to maximize the benefit, but was told that all I could pay was 35% and the rest would come back over the payment schedule. So that's going back to that previous question about, can you pay more out now while we still have the coverage in order to get the benefit. So I think you, Dave, you were asked to email that question to Alan, and he would look into it. Do you know how much on average the majority of members use mental health coverage in dollars?
I don't have that at my fingertips. We certainly have looked at that, and we've certainly been tracking when we look at our benefits spend and our leaves. We see that mental health issues are one of the leading drivers of usage, and so that's why we wanted to expand the providers and preserve as much of that benefit as we could moving forward.
Was there any consideration given to introducing premiums in the active plan, employee premiums, in order to retain more benefits?
No, and I think the question is we get the active member core plan is employer paid, and we did not consider adding an employee contribution or employee premium to that. The GCE sees that core plan as an essential employment benefit paid by the employer.
Okay. And are you planning to do consultation in the future in order to prevent plan changes from challenging our recruitment objectives and wondering if there's a way to influence things going forward at all?
Certainly, there's some things that, the situation that we were in, I don't think we had consulted every day. We would have changed the fact that we would have to have the level of premium increase that was identified in order to maintain that plan. In moving forward, part of our practice in the past has been we collect a list of the requests and complaints that members bring to our attention annually, and then they're reviewed. We have, I know, in the past had some opportunity through Connex to test potential benefits or changes in benefits, and we're looking at developing a new vehicle moving forward to replace Connex, and that would be a logical place that we would have some opportunity to do this. And I will also screen share again before Treena unplugs me. Just bring to your attention the new benefits website that was launched, and we were also hoping that that would be our primary vehicle of communication, and there was an issue with the translation of the site, and so I think it went live the same day that all of this broke, simply because of the complications we encountered in that work plan. But the website is there, and it has lots of resources for you, and that's where the plan booklet will be posted once it is finalized with legal and actuaries and the translators.
There's a question whether or not there's an opportunity for Green Shield to offer an optional coverage for employees that could be harmonized with the core plan that employees would pay for.
We haven't researched that. We certainly can. They do have products that they offer. Our research did show that private or commercially offered plans are substantially more expensive because they don't have reserves to draw on to underwrite the plan. So they are driven by the actual cost experience. We can have some conversation with Green Shield about it, but I expect we would find that it would not be any more affordable than we could have offered if we had done so.
I think it might be good to have that conversation, Alan, just because folks may be looking at things like Blue Cross or other independent to replace the insurance, and if we could maybe get some kind of group discount because it's harmonized with our other plans, it might be useful just to at least ask the question.
Yep.
Yeah, thanks.
You know,
So there is a comment about, you know, just the reduction of mental health services from 5,000 to 3,000 from the optional plan, just recognizing how hard the pandemic has been on mental health and folks, and whether or not there's any place that sort of for emergencies that people can get extra mental health funds.
as I said, there's the Financial Assistance Committee. If you have an exceptional need, talk with your regional council minister, and you can access funds in that way. The $3,000 benefit, of previously $5,000 in the optional plan, is $3,000 in the core plan. So everyone will have access to the same benefit, but we are, as I said, expanding the number of providers that you can turn to.
Great, thanks. And can you repeat the advice or info for clergy couples?
Yeah, just a quick contact to the Benefits Center, either by telephone 1-800 or, and I'll pull that number up in a moment, or to the email, and advise them that you and your spouse are both plan members under CORE, and you'd like to register one in your plan. So.
Can you not register both on both plans?
No, I think you both have coverage, but if you have a spousal or beneficiary listed, then it assists with coordinating the benefits.
Okay,
yeah.
Thanks. And there's a number of comments about a desire to have some recommendations about an external top-up plan, and whether or not we could negotiate some group rate for that. That would be
Okay.
That would be helpful. Is that National Compassionate Assistance Fund available to all employees, or just clergy?
It's available to all pension plan members. That's the eligibility criteria.
In the past, it has been difficult to access what is covered in the out-of-country benefit coverage. Where will there be details published somewhere about what is included, what is excluded, things like pre-existing conditions? In general, is there a published detailed document to go to along with the summary that was shared?
The detailed document, as I mentioned earlier, is not yet available. That's being worked through with the actuaries and with all the details that will accompany it. It basically is the contract, and so that is taking longer than we anticipated, and it will be ready sometime later next month. Meanwhile, you can look at the current out-of-country details, and it'll give you an idea of what will be available, because it's not significantly changing, say, for the amount that is covered.
So there's a lengthy comment in the chat, which I'll just try to summarize. Just naming the fact that this has very significant impact on people who are the most vulnerable and when they're ill, and that in this family in particular has done the math and figure out that is going to cost them about an additional $40,000 in things that they will have to pay for that are no longer covered. And just commenting that that's unsustainable for a family. And so are you doing anything to help with that impact, and recognizing that it affects people with disabilities the most, and I think just really feeling hurt and a lack of trust in the leadership as a result of all of this.
Again, I mentioned the financial assistance program, and certainly such extreme hardship would be a consideration for assistance through it. So again, through your regional council minister.
So that's someone from Chinook Winds. So feel free to have a conversation with Stephen Harper or myself, and we'll see what we can do to help you navigate the systems and look for options to apply to those support funds that are out there. Was any consideration given to partnering with other organizations that have benefit plans?
We've certainly, it's been suggested a number of times that we partner with other denominations, Canadian denominations. The problem with that is that their demographic profile looks very much like ours. We generally have had better benefit plans than they have had. And so with our benefits and their demographics, we would be looking at a worse situation than we currently have. We have not looked at, nor did we have a mandate to, or the resources to look at other public sector, private sector potential partners. That was out of scope for us.
And also, we're not a particularly attractive partner because of our demographics, because you'd basically be asking other agencies with a younger demographic to subsidize our plan. Yeah. There's just a couple more comments about the impact that this decision and the way that it was handled has had on the trust between employees and the leadership. I'm not sure that you can say anything more than you already have about that, but just a recognition that this is really, really difficult. And I know that it's been difficult on the people making the decision, as well as on the people that are impacted by the decision. We're going to be posting the sharing the website. I heard Alan say in a few minutes, so you'll be able to get the address then. Employee assistance programs, are those continuing as before?
Yes, they are.
That's good. Thanks.
Yeah.
So one person commented about the fact that when folks were complaining about premium increases being unsustainable, that they were unclear that it meant that there would be no optional plan in the future. And so maybe in future conversations or future decisions, communicating the potential consequences is something we can try to do a little bit more thoroughly.
Mm-hmm.
Any thought about effects of withdrawal of benefits on other benefits? If one has difficulty affording coverage in one area, then could they be going off on other leaves go up? So I think what is being alluded to here is that if you don't get proper mental health care in a proactive way, then you end up on long-term disability or restorative care. Was that a factor in your decision making?
Yes, and it is always consideration. If you trigger one change here, then what, or if you do one change here, what are you triggering elsewhere? And so those threads were followed, and we still were in the position that the recommendation was that the optional plan was not sustainable moving forward.
So a question about the managed formulary aspect of the new plan. Is there a dispute resolution process if you are prescribed a medication that is not approved by the formulary?
Yes, there will be, and there's always, even now, when there's been a medication that someone had a particular need to have that wasn't covered, then it could be disputed and adjudicated, and we'll have that same process in place moving forward.
So on the theme of trust, is there any other potential surprises like this? I think in particular what is the state of the pension plan, and is there anything people need to be afraid of going forward?
No, not in regards to the pension plan. I was going to say, barring any catastrophic global event, but we're living in one of those right now, and we have fared extremely well in the pension plan. We're currently at about 120% funded, which is a very good place to be. And the Pension Plan Advisory Committee meeting this week, actually, tomorrow, we'll be considering whether or not to recommend benefit increases in 2022, given our funding levels. And our funding levels are based on biannual formal actuarial valuations and in between quarterly estimates. And I just with a retiree forum the other day, and they were asking, do you take into consideration our demographic, our longevity, yes, all of those factors are factored in. And on top of that, we introduce 4 conservative modifications which have served us so very well in this last period, so that we have lots of buffers in place that help us maintain a prudent level of funding. And there's no reason to anticipate that we are at risk. The Pension Plan Advisory Committee will be receiving tomorrow a report on 3 severe adverse scenarios that they asked the actuaries to consider and in terms of our funding. And these are very extreme scenarios. We want to see, like, how do we test? How do we hold up under such duress? And it looks like we are in very good position, even given those scenarios.
Thank you. So I think I have come to the end of the questions, but there were a lot of them flying through there. So if I missed your question, can you just retype it in the chat now? Just because I want to make sure that I didn't overlook anybody. And in the meantime, I think Alan is going to share the benefits website link.
There. UCC benefits.ca. There are tools there for members, there are tools there for employers, and there's newsroom. The tools are mostly information. The tools that will allow you to do things like pension calculations or employers to insert information will be coming as we build out the new administration system that we're 1.5 into the 3.5 year implementation of. And so this site will be your portal to that. So member resources for the pension plan, for governance, pension governance, for group benefits, and a document library. And the newsroom, where you'll find new postings, updates around responsible investment initiatives, additional information on group benefits plan changes, and resources for mental health and other resources that are available through our employee assistance program.
Great, thank you. There doesn't seem to be any other questions, and I would just like to thank you, Alan, for being willing to be here with us today. It's not easy to agree to be part of a town hall where there's a lot of angry people coming. And so I really appreciate your willingness to be here, and I know that you're doing your best in a very, very difficult situation, and recognizing that nobody wants to be in this position, but that you're just trying to do the best you can to help us lead through or navigate our way through a very difficult time in the history of our denomination. And so we really do appreciate you and the work that you've been doing, and the way that you have been able to maintain a very calm and non-anxious presence throughout this whole thing, even in the midst of some very challenging and difficult behavior. So it means a lot that you showed up, and you can see that there's some lovely comments in your direction there in the chat. And I hope you will take a moment to read them, because I think they're heartfelt, even recognizing that you are the messenger. And we have to remind ourselves that that's it, that you're not the one all by yourself making these decisions. We know that there has been some challenge to the trust of folks, and that will, as a denomination, all of us, the regions, the national church, are definitely learning from this and knowing the things that we need to pay attention to better going forward. So thank you all for your patience and for your work on behalf of the church in this difficult time, and to all of you in BC who are impacted by this weather event. We are praying for you, and we'll be sending out some communication about that later today. So I think that kind of ends our formal time together, but we'll just keep the room open for a few minutes if folks want to continue to put comments in the chat, or if you have something that you want to say just informally, we can do that. Otherwise, have a great day, and thank you for being with us.
Folks, thanks for your time.
I'm just looking at some of the comments here.
Treena, did you say that the presentation was going to be made available?
Yeah, so if you look in the chat link there, Mauricio has posted the link to where that'll be available online. It usually takes us a little bit to get it up after the fact, but.
Okay, thank you.
It's nice to see you all here. Dave, yes, creativity at this time to figure out different ways to support ministers and options is a good thing. Like nobody wants to leave. You can chat if you want.
Alan, it's Graham. I wanted to say how excited I was to see that Anne is joining the pension board after her 9 years as PPAC. You're muted.
Yeah, and so has chaired the Pension Plan Advisory Committee, and she's a senior actuary with OMERS. And so we have moved her, as she's completed her 9-year term on Pension Plan Advisory Committee, to the board, recognizing that we have 4 long-term board members who are concluding their eligibility to serve, and so losing a huge brain trust there. So we're bringing Anne's 9 years onto the board, which is great.
Is Marcus's 9 years up too?
Yes, it is. Yeah. So Marcus Robertson, the chair, completes his term as well. We've just recruited to the board Marvin Bozak, who is the CEO of the Alberta Pension Corporations.
Awesome.
Yeah.
As much as it was tough, I miss sitting around that table.
And you are missed.
Yeah.
Always lively conversations, and the diligence that the members bring is really quite remarkable. We are so fortunate to have the constellation of pension experts and professionals that we have.
All right. right. Well, thank you everyone for being here. We're going to close off the room now. Alan, did you get a chance to look at the chat comments, or do you want us
I
to?
did. I
Good.
did have a quick scroll through them. So
Okay.
Yeah.
Mauricio, you'll save those, right? Okay.
okay.